Live from Columbia, this is a WIS News 10 Back to School Special.
We have to do what's right. If we fail to follow these mitigation strategies and use every tool available to us, I fear we'll be faced with a school year that we had hoped was going to be very normal, but with a school year with avoidable interruptions, which will be detrimental to our children.
Good evening, everyone. Thank you so much for joining us tonight for our WIS Back to School Special. I'm Judy Gatson.
And I'm Sam Blyweiss. Right now, the debate on whether students should wear masks in schools is driving a wedge between teachers, parents, and politicians.
During the news conference earlier today, you just heard there from Superintendent of Education Molly Spearman. She begged for all of us to take COVID seriously, saying that her heart is heavy and that she has never been more concerned for the health and welfare of our students and teachers.
So tonight, we are dedicating this hour to answering as many of your questions as we can as more students head back to the classroom. Our Chris Joseph sat down with Midland superintendents about the challenges that schools are facing in this new school year. And we will also hear from local doctors who will address concerns about masks and vaccines.
Dr. Linda Bell, our state epidemiologist, spoke at that news conference today with Superintendent Spearman. She is here tonight to answer more of your questions. Dr. Bell, thank you so much for taking the time. I want to say up front, everybody in the WIS building is vaccinated. That's one of our conditions of bringing people in, and we appreciate you wearing the mask, and we saw that modeled at the news conference today, too. Let me just ask you this. As you talked to the state today, and as you look at our numbers right now, if we don't make a change right now, very soon, what is your prediction for 2 weeks from now or a month from now?
Well, we can't expect to continue to do exactly what we're doing and not follow that same course. So unless there's change, as we're looking at the Delta variant that's highly transmissible, we're really in a completely different environment than we were months ago because of this transmissibility. So I remain extremely concerned of the disease surges that we will see if we don't get our vaccination rates up and we don't find a way to protect our children in the schools and follow the CDC guidance for what will keep our schools safe and what will prevent transmission in those school settings.
We want to cover as many viewer questions as we can. Sam is monitoring Facebook Live. We encourage everybody to jump on the Facebook if you have a question you want to submit. But, you know, Dr. Bell, there's been so much debate, and now is the time for action. So in the interest of settling debate, I just feel it's necessary to create a foundation for this discussion because we're specifically focused on our schools. So we know that there's a pandemic. We believe that. We know that there are dangerous variants emerging. And we also know that there's higher transmissibility than there was last year. So as we look at all of that, what do we need to keep in mind if our goal is to keep schools open?
Well, one goal would be not to debate issues that have been debunked. So for example, you know, so much of this has to do with the mask issue. And there is, there is no evidence that masks are in any way harmful to children. So that is something that should not continue to be repeated. It is simply a myth. So for people who are stuck on the issue of the potential for masks to do harm, that should not be repeated anymore. We should not be debating that issue. And that's a primary part of the conversation at this time, and so I want to make that very important point, that it is a very helpful measure, abundant evidence showing that on the basis of the principles that prevent the spread of diseases, masks work, and they should be deployed.
We're going to go through some of those questions about the mask debate coming up when Dr. Greenhouse joins us in just a little bit. I want to enter a question from Aisha, one of our viewers, who is concerned about younger children and ask if they are more at risk. She says, are younger children more at risk than older kids if they contract COVID? Can their little bodies fight it as hard? My 3-year-old is starting the Montessori program in a public school. I'm very concerned. Should I keep her home? Well,
that's a difficult question that many parents are struggling with. Now, we can't say that what will happen from one individual to the next. We do know that for the most part, children do well, but you can't predict which child will do poorly. And I know that pediatrics, specialists will speak to this. So we can't answer that for a specific child, and for that reason, that's why we need to do everything that we can to protect all children, to prevent the spread, because it's a gamble as to which child may do poorly, even if the proportion is relatively low.
Dr. Bell, let's talk a little bit. With a novel virus, information changes, right? We gather more data, and so people rely on what they heard last year to try and apply it to where we are now. And last year we heard so much about schools not being a place where we saw a lot of disease spread. What has changed?
Well, the new strain has changed, the transmissibility of that strain has changed, but we don't want to be in an environment where we're not using the things that are still effective. Because even though the Delta strain is much more readily spread than the original strain, that doesn't mean that masks don't work. It doesn't mean that the vaccines that are currently available are not effective against that strain. Those are still measures that work and that we can use. So yes, it is a different environment because of the transmissibility, but that makes it ever more important to employ the measures that we have that we know work.
I think another important distinction is when you say what we know works, we're not talking about a 100% guarantee against getting COVID. We're talking about mitigating risk. I've heard you talk a lot about a layered strategy, and I heard a Swiss cheese analogy that made a lot of sense to me, saying if you have one piece, you got a lot of holes in it, right? But if you put another piece on top of that, you cover up some of the holes. Another piece, you cover more of the holes. You get more protection overall. What are the protocols that the CDC and DHEC are prescribing for schools right now?
Yeah, that's exactly right. The layered approach is what's needed, because nothing is 100%, and the goal is to slow the spread, to reduce the spread. And those layers include, first of all, the use of a cloth face covering for kids that is well fitted, that's comfortable, so they'll keep it on. The next layer is for those who can be vaccinated, should be vaccinated. That's the most important measure, but for those children who cannot, we need these other measures. And that is physical distancing, that is a good hand hygiene, and as we move into this school year, testing will be very important, because we need to be able to identify children who are positive so that we can take measures to prevent the spread in schools and surround cases and prevent them from being in the school while they're ill or potentially asymptomatic but still potentially spreading the virus.
And you shared a startling statistic on the DHEC call recently to help us understand the difference between the regular strain and this Delta variant, that with the regular strain, you on average would see maybe 1 to 2 other people infected, but with the Delta variant, that metric changes dramatically.
That's true. This is what we use as sort of a measure of the estimation of the number of people that would subsequently be infected from one person. And with the original strain, that was about 1 to 2 people. With the Delta variant, we're looking at anywhere from about 5 to 8 people. So you can look at the multiplication of the number of cases. If 5 cases occur from one case and then 5 to 8 more cases around each of those cases. And the important point is that is among the unvaccinated. Those are the individuals at greatest risk.
We have another question from another viewer. This is from India Mack, who's raising a very important issue. What do we do for our children with underlying health conditions? Public schools have an obligation to serve and protect every single child that's in their classrooms, and a lot of children in South Carolina have health disparities.
That's true. And if they're old enough, we get them vaccinated. If they are not yet old enough, then we want to create protective bubbles around them, and we will say this again and again, but of course the use of masks. And one point about the mask is that some children that have underlying health conditions, they have a compromised immune system. They actually wear masks all the time because they need to be protected from the exposure to other threats, and those children do fine. So you know, those are the measures, and again, you make the great point that we have to use all of those layers that we have at our means, because some may not work, some aren't options for some children, and we need all of them.
Well, and we have to be realistic, right? In public schools, with all kids back in-person learning, social distancing, our schools are going to do their best, but it's just not possible or realistic to think they're going to be able to maintain 3 feet all day, every day. Also, you know, with the testing at public schools, I mean, there are a lot of protocols that have to be followed in order to have a reliable test result. So the things that are not practical put more of an emphasis on masking, right?
That's true, and an emphasis on the immediacy of the need to do things now, because the more we let this get out of control, the things that you point out will just become more and more difficult. We will see more and more disruption, and so we really desperately need to act now.
We are hearing about more and more breakthrough cases. In fact, DHEC sent out a news release, I think it was just yesterday. Some people will point to those cases to say, see, look, I told you the vaccine doesn't work.
Yeah, and that's not correct. So we are seeing more breakthrough cases, but the proportion of the breakthrough cases remains about the same. We're seeing more breakthrough cases because we are seeing more cases. And so the number, when we look at raw numbers, that sounds like a bigger number, but when we look at the effectiveness of the vaccine, and if it is effective in preventing severe illness of in the range of 95%, then we know that about 5% of the people may experience breakthrough infections. As the number of cases grow, then that raw number of breakthrough cases will grow, but the proportion remains the same.
And I heard a doctor describe it, this was a great analogy to me, where, none of the vaccines had 100% efficacy, right? So if you're at about 95%, it's a shield, and your shield is about up to here. But with the Delta variant or the other variants of concern that emerge, your shield might drop a little bit. Is that accurate, an accurate way to describe it?
Well, potentially. It's being studied if there's some loss of effectiveness of the vaccine against the Delta variant. But another important point to make is that for these breakthrough cases, the vaccine still does a great job in preventing severe illness, preventing hospitalizations, and preventing deaths. And so our ultimate goal in preventing those severe illnesses is still being achieved. But we need to work more because those people who may not have any symptoms, they can still potentially spread the virus. And there's a lot that's still being studied.
So what can our schools do to protect our children, particularly the most vulnerable, if they are not allowed to implement universal masking?
Hard to answer. I think that the schools have the right idea. I hope that the schools can work more closely with the parents to convince the parents that when they have the option, that they should adopt the measures that will protect their children, protect their children's friends, protect the staff members who are caring for and educating their children. So more parent education about the fact that these can be safe environments if we have high compliance.
Dr. Bell, I want to ask you about this as well. I know that you are not a politician. You have worked very hard to stay out of that realm. But when it comes to implementation of DHEC's public health response, how frustrating, complex, complicated has it been to have an effective implementation when we've had so much mixed messaging based on what we're hearing from you and DHEC compared to what we're hearing from elected officials?
Well, whatever the source of people who may be following misinformation, it's extremely frustrating to witness what I don't have another word at this time besides devastation. When we have measures within our reach to prevent this, and so wherever the barriers are coming from to help schools implement those measures is simply frustrating. It's disheartening.
Dr. Bell, again, thank you for your time being with us this evening. We know you're going to stay to join us in our second half hour with pediatrician Dr. Deborah Greenhouse, who shared some valuable information and was at that news conference earlier today. And Sam, I know you've been monitoring on Facebook. I'll hop on the Facebook Live now and keep answering as many questions as we can.
Yeah, continue to send us your questions. We're watching it live, but safety, Judy, is the top concern of Midland superintendents heading into this school year. And DHEC at this point has already tallied 287 students and staff with COVID-19 cases statewide. Our Chris Joseph connected with 4 local superintendents about the state of their district. So Chris, who did you talk with?
Yeah, Sam, I got an opportunity to speak with Richland 1, Richland 2, Lexington, Richland 5, and Lexington 1. Of course, their goal right now is to keep everybody safe and their buildings operational. Big part of that is making sure they're staffed.
Oftentimes we don't create the issues, we have to manage them.
The superintendents I spoke with preached flexibility. Each of the 4 districts have published a COVID-19 plan featuring social distancing, contact tracing, and cleaning. LR5 saw 3 high schools close last December after a high number of teachers were either sick or called out in protest. Interim Superintendent Dr. Akil Ross says the district has contracted with a substitute service to meet its teacher shortage and rolled out a plan to change with the pandemic.
But we're working very hard to make sure that there's a quality teacher in front of every child when they come to school. And we'll be working through the year to reach that. We will have to use subs. We will rely on substitutes until we're at full capacity. I hope that this mitigation system allows teachers to feel a little control of the environments in which they're placed.
R1 and R2 say they're staffed, but are preparing for a variety of situations.
We're looking at things like providing each school with a permanent substitute on staff. Absolutely, there will be situations where classes may have to be readjusted or may be combined or may have to meet in a different space. But we're not going to overcrowd our classes to make that happen.
And I will go back to those mitigating strategies. What do we do on the front end to avoid, to ensure that some of these worst case scenarios don't happen? And I think that's critical.
Lexington 1 is operating under the loosest mask rules, with no local requirement and no requirement for school buses.
You know, we still take an all hands on deck approach that our number one criteria and our priority is making sure that kids are in school 5 days a week and they're safe doing it. And so it also may require people within the school, you know, substituting depending on what that looks like day to day. But so it's an all hands on deck approach, but we've really tried to take efforts increasing substitute pay, adding, you know, some of the support staff features as well to try and try to assist and make this the smoothest school year that we possibly can.
The districts have facilitated vaccination clinics for their teachers, but exact percentages on the number vaccinated were not immediately available. So to Judy's point a little bit earlier in the show, I asked all 4 superintendents about that 3-foot separation for social distancing. The consensus is that will be very, very challenging. Reporting in the newsroom, Chris Joseph, WIS News 10.
Chris, thank you so much. And up next, we are going to sit down with a Lexington medical pediatrician about what they are seeing in hospitals and in their practices as COVID cases are on the rise among children.
Protect your family, your friends, your neighbors, the people who care for you. Save a life. Wear a mask.
Well, we want to bring in Dr. Lauren Matthews from Lexington Pediatric Practice. Lauren, thank you so much for being here with us today. We really appreciate your time and your expertise, so thanks for taking it.
Absolutely.
So you are at Lexington Pediatric Practice. Obviously, you work with a number of kids and families. Talk about, first of all, what you're seeing right now in your practice when it comes to COVID-19.
So similar to what Dr. Bell mentioned earlier, the first go around last school year, we were seeing very little child-to-child transmission. But this year with the Delta variant, even over the summer and at summer camps, we are seeing a lot more children being infected by other children within the summer camps or just being around other children in general.
And that's the Delta variant, obviously, is changing the game for you guys there in your practice. So how are you adapting to the change?
So we're trying our best to keep everyone safe. So encouraging everyone to wear a mask when they can't be socially distanced, especially as children prepare to go back to school. Our younger children cannot be vaccinated. They're not old enough yet. So we have to set a good example by wearing masks whenever we can. That way children can see that it's not so bad.
There are a number of debates and misconceptions about the mask wearing, and we're going to get into that more in our second half hour. What are you telling parents who are hesitant to put masks on their children as they head back to school? They're saying that they're worried about hindering their learning or that it affects their socialization. What are you telling them?
Well, luckily we've had the whole past school year to look at that, and we haven't seen any evidence to suggest that wearing a mask hinders a child's learning at all. In fact, it's the best way that we have to protect our children that can't be vaccinated.
You know, I'm sure you're seeing a number of immunocompromised children within your practice. Those are probably the kids that you see the most, right? So for them, as they go back to school this year, and you know, many schools are not implementing a universal masking mandate, what are you telling parents about mitigation measures that they can encourage their kids to do at home and to take into the classroom with them to keep them safe?
Well, that's exactly right. We need to start at home by practicing wearing masks and also good hand hygiene. Unfortunately, we can't speak for every child that's immunocompromised, so if you have any concerns, you should talk to your child's pediatrician because they know them best.
Right, and you know, if done right, we have talked about this before. Schools can be a safe place for kids, right? Even in the midst of this pandemic, if we do the right things. We know that classrooms are going to have a hard time with the 3 feet social distancing. We know that, obviously, as I said, the universal masking is not in place. Maybe, you know, you're working with young kids and they don't necessarily wash their hands as much as they should. How are you advising parents advocate specifically for their kids' health inside the classrooms?
Well, I think that's an important conversation to have with your child's teacher and set expectations with the child as they enter the classroom this year. Unfortunately, teachers already have their hands full educating our children, and they really don't have all of the time necessary to be devoted to being mask police. So we need to help the children understand the importance of it and take some responsibility.
So I would imagine that in your office, you're getting a number of questions from parents. Maybe they're looking for information, or maybe they have misinformation. We've talked a lot about social media and how myths are spreading, fiction is spreading online. What are some of the most common things that you're hearing in your office from parents who may be misinformed with some of the data?
I think with this COVID pandemic, the misinformation has just been detrimental to our overall efforts to help drive this virus down. One of the most common ones that I'm hearing now is centering around the vaccine. There are a lot of misconceptions about this vaccine can alter my DNA, this vaccine can affect my fertility, and those are just not true. But there's a lot of things circulating around on social media that are just perpetuating these false statements.
And listen, let's give parents the benefit of the doubt. Maybe they don't know where to go find that information. Where would you tell them to begin?
Absolutely. The CDC and the South Carolina DHEC websites are great places to start. The American Academy of Pediatrics also has a website that has lots of information that's easy for parents to understand.
Absolutely. So there was a question that came through on social media right before I walked over here. And it's a question from Lisa, and she wants to know the number of kids under the age of 11. Obviously, vaccines are not approved for kids under the age of 12. So what is the difference that you're seeing in terms of last year to this year with the number of kids who are infected?
We are seeing more and more children affected. We've seen it in our children's hospital that has increasing rates of hospitalization compared to last year in particular. So we know that the children, while they have a low risk of mortality from it, they can still have long-term health benefits, and so they are still being affected. This isn't an old person's disease.
Right, and to that point, you mentioned the transmissibility. We're going to talk a lot about the transmissibility of the Delta variant versus where we were last year. So what is the difference in your medical expertise view? What's the difference?
I think it's just viruses love to mutate, and when they mutate, they get smarter, and so that increases the transmissibility and infectivity of it.
Indeed. Well, Dr. Matthews, we appreciate all of your expertise, and we know that you're working to keep kids safe as they head back to school this year. So thank you for your time.
Thank you.
We will be right back after this.